I apologize for the insanity of the rapidly disappearing overheads. Thank you.
Next, I'm going to invite up Dr. Alain Demers, who obtained his Ph.D. from Laval University in 2000. From 2000 to 2010, he worked for Cancer Care Manitoba in Winnipeg, where he developed an expertise in cervical cancer and cervical cancer screening epidemiology. He was recently hired by the Community-Acquired Infections Division of the Public Health Agency of Canada, where he works on the surveillance of human papillomavirus infections in Canada. Thank you.
And the Métis and First Nation population is pretty high. It's around 15 to 18% of the population there. And because the northern clinics participated very well in this project, so we are able today, I'm able today to show you some result of what happened in the First Nation and the Métis population there in Manitoba. So along all my slides, I had to combine both Métis and First Nation because the numbers were relatively small. So I have 113 women, Métis or First Nation, that participated in the study, and overall we have close to 600 women that did participate in the survey. And this is the people that helped and participated in building this study and conducting this study. So Brenna Shearer was the manager of the cervical cancer screening program in Manitoba then, and she's a very active woman. Magdi Dawood and Alberto Severini did all the HPV typing. Robert Lataki is a medical advisor for the screening program. Eric Cleaver is an epidemiologist working with me at Cancer Care Manitoba. Shelley Stopera works for the Manitoba government, Manitoba Health. She's really involved into bringing in Manitoba new screening techniques and the vaccine. And the fact people, Gaia, Yang, and Tom, that made this project feasible. Oh, here we go. So just give you a little context about Manitoba. So that's a relatively small province, 1.2 million people. Screening, HPV screening doesn't exist in Manitoba. There's no test unless the physician asks for it. Conventional cytology pap tests are used to do cervical cancer screening. Women are referred to colposcopy for the most severe lesion or repeated low-grade lesion, like in any other jurisdiction in Canada. In 2001, organized cervical cancer screening program was put together in Manitoba, and all the results of the colposcopy and the pap tests are centralized in this one unit there, which is something very practical when you are an epidemiologist and you need a number. So every year since 2003, I think approximately, the screening program organized what they call a PAP week. A PAP week is 1 week during the month of October where there's a huge publicity about cervical cancer screening all across Manitoba. And for 1 day during that week, women are invited to attend clinics. So without appointment, so they just show up, they say, I'm coming for a pap test. And the participating clinic, which is usually around 100, a bit over 100 across the whole province, take them, have a pap test, and then without any further use, just walking like this. And in 2008, oops, I'm going the wrong way. In 2008, we said, well, let's use this setup there that's very efficient and it works very well to try to do this research project and we had exactly the same objective than in Nunavut. We wanted to know what was the baseline rate of infection, HPV infection in the community, in the population before the vaccine arrive and has an impact. So we are able in the future to compare what was before the vaccine and what is happening now or in 5 years or 10 years. So 52 of these clinics decided to participate in the study. We recruited 592 women on 1 day in October 2008. We administered the risk factor. HPV typing was performed at CADAM lab, but using an NML technique that was developed by Alberto Severini and Magdi Dawood. And I will talk more about the statistical analysis later. Yes, you will see I like numbers. I'm an epidemiologist, so you'll see a lot of them. So, and this is the poster that was posted in the clinic, participating clinic, where we were just inviting women to be part of the study, need to be 18 years of age or older. And if you're interested in knowing what if you are infected with the HPV virus, well, you can participate in the study. It was quite broad, and the staff of the clinics also invited this woman. So the survey had 30 questions. I'm presenting here just 6 of them. That's a lot number. We'll just go through one of them. So together, so you have a little ID. If I can have my arrow here, which doesn't appear. Okay. So. Can I just walk with the microphone a little bit? Let me see. So I can get closer to the screen. There we go. So I will just go through one of these variable here, and they're all the same. So after that, it would be easier for you to understand. So here I divide these women into groups: the one that are less than 30 years of age, and one that 30 years of age and older. And among each of these 2 groups, I look at the women that were HPV negative, so they had no sign of viruses, and those that were HPV positive. And here, what I see is that 24% of the women that reported an ethnic background to be Métis or First Nation were HPV negative. So among all the HPV negative women that were less than 30 years of age, 24% were Métis or First Nation, 50% were Caucasian, and 13% here had the other ethnic background. And same thing here. But in that case, it's for the women that are 30 years of age and older. And what's important in this table are these 2 numbers here, which are the p-values, and tell you if there is an association between the fact that you are less than 30 and you have HPV infection, yes or no, and that you are in that ethnic background. So what it tells you, for example, this number here tells you that if you are less than 30 years old, your ethnic background doesn't have an impact on the fact that you will be HPV positive or HPV negative. But if you are more than 30 years of age, it has an impact. And usually it's women that are Métis or First Nation here that were more infected. So, and if I go through the other variables here, I look at the financial situation, where it says that if you're young, your financial situation has no impact on the fact that you will be infected or not. But if you're older, it has a slight impact. If you're a current smoker, it seems that whatever your age, it will have some impact on your risk to be infected with HPV. Oh, I have to figure out that wheel. And these are 3 of the other factors we looked at. So we looked at the if your women ever report to have a pap test, and that has an impact on the fact that you will be HPV positive, which is a bit surprising when you look at it. You see that women who had a pap test, reported to have a pap test, are more HPV positive, which tells us basically that all these pap tests that were done there were not screening pap tests. Some of them were diagnosis pap tests, and that's why we see this number there. So the lifetime sexual number of partner has a huge impact on your risk to be HPV positive or not, whatever your age. And the fact that you are currently or not in a stable relationship also has some impact. So this is the age distribution of the women that participated, the 592 women that participated in the study. So as you can see, we have a relatively good, we have all the age group basically. Here what you see is a count of women over all these different age group by 2 years of age. So we're pretty surprised to have that, but very pleased to have it because it covers the population very well. And this is how these women here, so you have the graph at the right there that is just the one that I presented you. And here, among these women, this is the percentage that were HPV positive. So, and this is a very classical kind of distribution. You see that when you're young, the women are young, they are more at risk of getting an HPV infection. It goes down. And then in many populations, there's a little bump afterward. People don't know exactly what it means. It may mean that you are more sexually active when you were in 30s and 40s. It may also mean that you had an infection in the past and then it's coming back. So these are, the jury is out for that, but that can be potential explanation there. And if I break this graph that I just showed you in different HPV types, this is what we're finding. So again, I will guide you through that. So here we have the black bars here are the one that tells you about the prevalence of HPV 16 and 18 in the population, which are the two HPV types that are targeted, two of the HPV types that are targeted by the vaccine, and the one that also give approximately 70% of all the cervical cancer. And so what you see is that whatever your age, we find little infection with HPV 16 across all the different ages there. The red bars here are represent the prevalence of HPV 6 and 11. And so these are the two other HPV types that are targeted by the vaccine and will give up to 90% of the genital warts. And genital warts. So, and we didn't find any of these HPV types in older women in the population. So, and I won't talk about the two other bars there, but this is the high risk and the low risk, other high risk and low risk HPV type. And we had exactly the same question than any other places have. If we buy this vaccine, if we have our population vaccinated, does it have an impact? And it will have an impact on in the population. And here, that's all the HPV infection that we found in in our population that participated the study naturally. So the bars, the black bars here are the vaccine target, the HPV that are targeted by vaccine. And the one with the little bars here are the other high risk. So and when we see that, we say, well, yes, it seems that it could be a good thing to have a vaccination in our population. So now I talk about the general population, all the participants in our study. And then all the other slide, I will compare what we found in the Métis and First Nation to this study participant.